Fox Business Alert: artificial intelligence is being, you know this, integrated into everything from software to manufacturing. But now it may also be the key to something we all crave: a good night's sleep. Enter ResMed, the medical device maker that produces CPAP devices and ventilators to help with sleep apnea, chronic obstructive pulmonary disease, and other respiratory conditions. A CPAP machine, for those of you who don't know, it's this device that provides continuous positive airway pressure for those who suffer from sleep apnea. It mechanically helps those sufferers breathe while sleeping. In December, ResMed got FDA clearance for its AI-enabled setting called Smart Comfort to be integrated into its AirSense 11 CPAP devices. For the 30 million Americans who suffer from sleep apnea, let's hear more about this. Joining me now in a Fox Business exclusive is ResMed CEO Mick Farrell. Mick, Smart Comfort, I mean, just in December you got this approval. I know it's currently sort of in a limited beta launch, but knowing how many Americans suffer from sleep apnea, I'm sure they want to know how it works and how they can get their hands on it. How does it work?
Well, Liz, firstly, thank you for having me back on your amazing program here. I think last time I was here, we were talking during the break was during the COVID supply chain crisis when we couldn't get semiconductors that are the power behind AI. And as you said, we got FDA clearance for Smart Comfort just at the end of last calendar year. What this Smart Comfort does is it turns natural language processing. So a person who is a patient of sleep apnea disorder can interact with our Smart Comfort systems and be able to have conversations like, how do you best like to sleep? Do you like sleeping like you're dreaming of walking through the mountains, or sleeping like you are on a beach in Costa Rica? And therefore, the algorithm can then adjust temperature, pressure, and settings to provide smart comfort so that you can sleep better, breathe better, and ultimately, by using our therapy, you can save your job, you can save your marriage, you can save your life. So having AI interact with you to adjust settings that 95% of people didn't adjust before, but with this AI technology, these sort of consumer comfort settings can drive great clinical outcomes.
It feels like, if I'm hearing you correctly, that it's like customized, whereas before it was, in a way, one size fits all, not entirely, but to be able to be that specific about the kind of sleep you want, amazing.
Yeah, Liz, exactly. We have algorithms within the machine, clinical algorithms that are very specific to customize the pressure that's just enough to keep your tongue off the uvula to prevent that sleep suffocation. Gentle, less than 1-2% of atmospheric pressure, but just enough to keep the airway open. So clinically, we've been using algorithms for decades, but this is the first time we've used AI to adjust comfort settings, temperature, humidity, how long it takes you to fall asleep, how you like to wake up. And these types of things actually drive clinical outcomes as well. We also have another AI technology that we've brought to market, Liz. We call it Project Dawn, as in the sun rising dawn, not a lady, but we call it a digital sleep health concierge. And this AI is designed to help you go through all the screening questions like, oh, I snore, or my bed partner snores, or I wake up, or my bed partner wakes up unrefreshed. And those types of screening questions can also be treated by AI and help you find a path to home sleep apnea testing or in-lab testing, and ultimately a prescription to our therapy for life.
Tell me what the feedback has been for those who are part of the beta launch.
Well, look, what I can say, Liz, is that we're tracking these data very carefully. And as you know, you followed us for decades. We're a very science-driven organization. Yeah. We're going to look and track not just the comfort and the sort of net promoter scores that a consumer company might look at. We're going to look at medtech outcomes. So we're going to look at how long patients use therapy. Is there better adherence? And we know adherence is correlated with saving lives, because a person who uses a CPAP to treat their sleep apnea has a 37% reduction in mortality. So this is not just a therapy that you should use to not snore and have a better, get back from that sleep divorce, get back into the bedroom. It's all about not just saving your love life, but it's about saving your actual life. And that's what we're going to track with this comfort feature. Do we drive up adherence? Do we save more lives? So watch this space for that, Liz.
Science has proven that obesity contributes to to getting sleep apnea. And therefore, the GLP-1s out there have helped a lot of people lose weight, and then they don't suffer from sleep apnea anymore. Have you modeled into how GLP-1s might hurt your bottom line or affect your bottom line in some way if people are able to lose weight much more quickly and effectively, and they don't need CPAPs anymore?
Yes, Liz, we've been tracking this amazing trend of this new class of medicines, these glucagon-like peptides, GLP-1s. And a year and a half or 2 years ago, there was a big bet against not just ResMed, but a lot of med tech that these GLP-1s were going to stop cardiovascular disease, diabetes, and sleep apnea and many of these other areas. Sleep apnea has many risk factors, age, gender, craniofacial anatomy, as well as weight. What we found is that these GLP-1s, as they get prescribed more and more, are driving patients into the primary care physician like never before. And we are tracking over 2.1 million patients on a GLP-1 and on our positive airway pressure therapy. And what we're seeing is not that they use the devices less, as in it would be a headwind for our business and for our treatment. It's a tailwind. Eli Lilly, with their product Zepbound, has an indication for use to what I call half-treat sleep apnea, so a 50% reduction in the snoring and the suffocation index. The only way to completely eliminate sleep apnea is through a medical device like a CPAP, APAP, or bilevel from ResMed. What we're seeing is Lilly is bringing patients into the primary care physician. Mm-hmm. We're educating and re-educating primary care physicians on the gold standard treatment, which is CPAP. And a lot of these patients are getting combination therapy. And we think it's always been about treat the sleep, treat the breathing, treat the airway, and lose weight if you can. So the addition of this new medicine is actually a tailwind for ResMed, and we're tracking it very carefully. But these patients on a GLP-1 start therapy more and use therapy more at 1 and 3 years.
Well, I know a lot of people suffer from sleep apnea. Can you make a device, Mick, that can stop those recurring nightmares that I'm 1 credit short of graduating from college? Because if you can do that, I'll be very happy. That is my recurring dream. I'm like, oh my God, I didn't take enough classes. Wait.
Well, Liz, I'll tell you this. If you use our product and sleep well and breathe well, you actually do get more REM sleep, which is where you have these great dreams, and the synapses of that stress of the credit or the person who cut you off in traffic, those synapses get deleted in REM sleep and slow wave sleep. So get a good night's sleep and you will earn that credit in your dreams.
Yeah, well, I know it's funny. I'm hearing, oh, we have that dream too. A lot of people do. Mick, you've made dreams come true for a lot of people with your products. So thank you for coming on to talk about this one.
Thank you for having me back on your program, Liz.
Nice to see you.